Taking a live look from the state capitol, California lawmakers approved a plan today that will scale back the state program that provides health insurance to undocumented people. It's part of the legislature's overall state budget proposal as they work to close a $12 billion budget gap next year.
KCRA 3 Capitol correspondent Ashley Zavala explains the development.
What the California legislature passed today is simply their version of the state spending plan. It is not the final say on how exactly taxpayer dollars will be used for the upcoming year. Lawmakers typically pass this, what's known as a placeholder, so that they can get paid. They have a deadline by June 15th. This kicks off negotiations between state lawmakers and the governor over how exactly to spend taxpayer dollars. And the biggest discussion will be around health care for undocumented people.
Ayes 26, noes 8, the measure passes.
Strapped for cash, California lawmakers moved forward with the plan to scale back the state program that provides health insurance to low-income undocumented immigrants.
And now we are treating like they are expendable. It is for those reasons that for the first time in my career here in the Assembly, I will not be supporting this budget today.
Democrats divided with concerns some of the 1.6 million people on the program could lose access. Starting in January, most lawmakers agreed to no longer allow new undocumented adults to sign up, which Governor Newsom has also proposed. But unlike the governor, who called for a $100 monthly fee for those who already have it, lawmakers want to lower it to $30 and have that go into effect in 2027.
These changes, you never want to have to do them, but we're in a position now where we have to balance our budget, and I think we're doing it in a way that avoids the most harmful and draconian cuts.
The state is still set to spend about $12 billion on the program, money Republicans say the state does not have.
In order to do that, they're taking away vital payments to doctors, nurses, clinics, hospitals, who were promised greater reimbursements.
Now, neither budget chair in the Assembly or Senate would share how exactly those conversations are going so far with the governor on this. We know that they'll spend about the next couple of weeks trying to finalize the state spending plan, which goes into effect July 1st. Reporting at the state capitol, Ashley Zavala, KCRA 3 News.
Health care for undocumented people is one small piece of the state's overall budget, which is expected to be at least $320 billion this year. Lawmakers are proposing to spend about $3 billion more this upcoming year.